Hello students, welcome to this session, chapter 15, that is surgical site infection. So it is infection that develops at surgical site within 30 days of surgery or 90 days of surgery of breast, cardiac or joint. The microorganisms are most commonly identified are or isolated are Staphylococcus aureus, gram-negative bacilli and anaerobes. The diagnosis is purulent pus from the surgical site or local signs of infection and culture positive from discharge collected from the surgical site. The risk factors procedure wise, so improper surgical scrub, inadequate skin antisepsis, prolonged operation time, inadequate antimicrobial prophylaxis, poor peri-operative glycemic control, emergency procedure, pre-operative shaving. Then according to the patient criteria, age more than 60, malnutrition, diabetes mellitus or other comorbid conditions, then low immunity, MRSA carrier, duration in hospital is more, smoking, obesity, history. Then organism wise, it is bowel surgery, bacteria, viruses form biofilm. Then environment, so positive for blood clots, sutures, foreign bodies, contaminated medicines, inadequate ventilation. Classification of wound is of 4 types: class 1, class 2, class 3 and class 4. So in class 1 it is a clean wound, there is no inflammation, that is sign of inflammation like redness or swelling or temperature, no hollow viscous entered. Class 2 clean contaminated wound, hollow viscous entered. Class 3 contaminated wound, no purulent inflammation plus necrotic tissue. Then class 4 is dirty infected wound and there is sign of active infection. Classification of SSI, superficial SSI, that is skin and subcutaneous tissue involvement, and it is within 30 days. Deep SSI, muscle and facial layer is involved and it is within 30 days. And organ and space SSI, that is organ space is involved within 30 days. So prevention of SSI, so first is pre-operative prevention. So in that pre-operative bathing of the patient should be done with help of antimicrobial soap. Then MRSA carrier for the patients, then mupirocin ointment is used. Then hair removal should be done by clipper, not shaving is not done. Intraoperative, so SAP, that is surgical antimicrobial prophylaxis is there. So it is should be given 60 to 120 minutes before incision, and antibiotics used can be cefazolin or cefuroxime. Then single dose should be there, or if surgery is more than 4 hours or surgeries like cardiac surgery or where extensive blood loss is there, dose can be repeated. Then surgical hand disinfection with antimicrobial soap or chlorhexidine or alcohol based hand rub should be there. Then surgical site preparation, it should be by alcohol based chlorhexidine or antiseptic solution used for the surgical site preparation. Then perioperative, there is maintenance of the oxygen, that is 80% FiO2, temperature should be normal, blood sugar level should be less than 200 mg/%, normovolemia and nutritional support should be there. In post-operative wound dressing, daily with hand hygiene and gloves. So while doing dressing, hand hygiene should be done first and then gloves wear and then the dressing should be done. Then OT disinfection should be there with high level disinfection in surgery and in between surgery and at the end. Then periodic monitoring of air quality in operation theatre. There is no air exchanges, temperature, humidity, pressure, microbial contamination all should be monitored. And then prolongation of the antibiotic prophylaxis is not recommended because of the antibiotic resistance. These are my references from which we can study. I hope this session you will find useful. Thank you.